Hmm. Good morning, all. I'm Dr. Thavan Mummaneni, postgraduate in C. Devarajas Medical College, Tamka, Kolar. My title of the short study is Evaluation of Paraspinal Muscle Epimuscular Fat in Subjects with Low Back Pain in a Tertiary Care Setting. Kodar Sir Dr. Harni Bopaya, Professor in Department of Radiodiagnosis, C. Devarajas Medical College, Kolar. Low back pain is a widespread and debilitating condition affecting up to 80% of individuals during their lifetime. Chronic cases often involve structural changes in the spine and paraspinal muscles, particularly the multifidus and erector spinae, with atrophy and fatty infiltration contributing to its instability. While intramuscular fat index is well studied, less attention has been given to epimuscular fat, a distant fat layer external to the epimysium that may disrupt muscle biomechanics. Evidence indicates that epimuscular fat is more prominent in lower lumbar spine, particularly at levels L4, L5, and L5S1, which are subject to greater biomechanical loads. This accumulation of epimuscular fat in conjunction with intramuscular fat has been linked to low back pain, through the relationship remains poorly defined. Anti-resonance imaging is a gold standard imaging modality for assessing paraspinal muscle morphology and composition, providing high resolution detail on both intramuscular and epimuscular fat. Aims of my study are analysis of epimuscular fat in the lumbar spine muscles and its association with vertebral level in patients with low back pain, to explore the differences in epimuscular fat in association with age, sex, body mass index, and low back pain. Type of study is a cross-sectional study. Study population includes patients referred for MRI LS spine in view of low back pain for diagnostic evaluation to the Department of Radiodiagnosis. Study will be conducted at R.L. Jalapa Hospital and Research Center attached to C. Devarajas Medical College, Kolar. Such a pre-prepared forma containing the patient details, clinical history, physical examination, and investigation who meet the inclusion criteria will be subjected to MRI. Details of the study protocol will be explained to the patient. Sample size is 56. Inclusion criteria: adults aged 18 to 65 years, individuals with chronic non-specific low back pain, that is more than 3 months, participants who consent to undergo lumbar spine MRI. Exclusion criteria is history of spinal surgery or vertebral fractures, presence of spinal deformities, comorbidities preventing participation in imaging or assessments, any contraindications to MRI, or those who did not provide consent. MRI scan will be performed in Siemens Magnetom Avento 1.5 Tesla MRI machine in the Department of Radiodiagnosis over a period of 3 months. It is a hospital-based cross-sectional study. A total of 56 patients will be included in this study, and informed consent will be taken from patients fulfilling the inclusion criteria. Imaging protocol includes T2 weighted and Dexon fat water axial images of L5 to L5 levels, L1 to L5 levels, cross-sectional areas of multifidus and erector spinae muscles, and qualitative ratings are taken by epimuscular fat graded on a scale of 0 to 5 based on extent along multifidus erector spinae muscle borders on each side of the spine, adding to a total of maximum score of 10. Obviously, low back pain scores were used as a clinical low back pain scale for the study. Results are: these are demographics with 24 females and 32 males. The demographic characteristics of age has a mean value of 45.3 plus or minus 12.7, BMI 27.4 plus or minus 4.5, low back kick duration is 12.5 months plus or minus 6.8 months. OST score is 38.2 plus or minus 12.5. Comparison of epimuscular fat scores by sex. This table represents male mean epimuscular fat 5.3 plus or minus 1.8 standard deviation with p-value less than 0.1, and female 24 with mean EF of 4.1 plus or minus 1.2 with p-value 0.12. This is a tabular form of mean epimuscular fat scores at each lumbar level. L1, L2 level is mean 4.2 with a standard deviation of 0.8. L2, L3 level 5.2 with standard deviation of 1.0. L3, L4 level with mean epimuscular fat score of 6 with standard deviation 1.2. L4 level it is 7.5 with a standard deviation of 1.5, and L5 level its mean epimuscular fat score is 7 with a standard deviation of 1.4. The correlation between epimuscular fat scores with age and BMI are: age with epimuscular fat score shows a correlation coefficient of 0.45 with p-value 0.01, and BMI and epimuscular fat score correlation coefficient is 0.5 with a p-value of less than 0.01, showing moderate positive. Epimuscular fat scores by low back pain severity categories, with low back pain severity of mild with 10 patients with mean epimuscular fat of 3.5 and plus or minus 1.2 standard deviation, and moderate 30 patients with 5.2 epimuscular fat with plus or minus 1.4 standard deviation, and severe back pain total 16 patients with 6.3 epimuscular fat mean with 1.1 standard deviation with p-value of less than 0.01. This is a case of 51-year-old male with an OST score of 42 years. The axial sections are taken at L1, L2, L2, L3, L3, L4, L4, L5, and alpha S1 levels. The L1, L2 level shows epimuscular fat scoring of 1 plus 1 of 2, and at L2, L3 level, the epimuscular fat score is 2 plus 1, giving a total score of 3. At L3, L4 level, the grading is done with the epimuscular fat score of 4 plus 3, total 7. And at L4 alpha level, a total score of 4 plus 4, giving 8. And at L4 alpha level, the grading with 3 plus 4, giving a score of 7. With the results, the study encompassed 56 participants with mean age of 45.3 years, plus or minus 12.7, predominantly male, and an average body mass index of 27.4, with standard deviation 4.5, categorizing the majority as overweight. The average duration of low back pain among participants was 12.5 months, plus or minus 6.8, with a mean obviously low back pain questionnaire score of 38.2, plus or minus 12.5, indicating a moderate level of disability. These demographic and clinical characteristics align with existing literature, which identifies middle-aged individuals and those with higher BMI as being at increased risk for chronic low back pain. The association between EF and LBP severity was particularly noteworthy. Participants with mild low back pain had a lowest mean EF score of 3.5 plus or minus 1.5, 1.2, followed by those with moderate low back pain with 5.2 plus or minus 1.4, and higher scores were obtained in participants with severe low back pain 6.3 plus or minus 1.1. The chi-square test revealed a significant relationship, p-value less than 0.01, indicating that higher EF accumulation is associated with increased severity of low back pain. These findings align with the hypothesis that EF impairs muscle function and spinal stability, thereby contributing to increased pain and disability. It suggests that epimuscular fat may not only be marker for muscle degeneration but also potential contributor to the perpetuation of low back pain. While the study provides valuable insights into relationship between epimuscular fat and low back pain, it is limited by its cross-sectional design, which precludes the establishment of causality. The sample size, though adequate for detecting correlations, may not capture the full variability of the population. Future studies with longitudinal designs and larger cohorts are recommended to further elucidate the causal pathways and the potential therapeutic implication. Moreover, the study was conducted in a single tertiary care center, which may introduce selection bias and limit the applicability of the results to different healthcare settings. Additionally, reliance on qualitative epimuscular fat scoring may introduce subjective bias despite efforts to standardize the grading process. Employing qualitative imaging techniques in future studies could enhance the precision and reliability of epimuscular fat assessments. Final conclusion, the findings of this study demonstrate a significant association between epimuscular fat accumulation and factors such as age, BMI, sex, and the severity of low back pain. The higher prevalence of epimuscular fat at lower lumbar levels suggests a localized response to biomechanical stress, potentially contributing to spinal instability and pain. These results emphasize the need for comprehensive muscle assessment in patients with chronic low back pain and suggest that targeting epimuscular fat may offer a novel avenue for therapeutic intervention. Addressing epimuscular fat accumulation through targeted interventions may offer a novel approach to improving muscle quality, enhancing spinal stability, alleviating pain in affected individuals. Future studies with longitudinal designs and larger, more diverse population are essential to further validate these findings and explore the causal pathways linking epimuscular fat and low back pain. These are my references. Thank you.